last week, the CBO released updated numbers showing projections of the Senate health care bill, and Steve has charts on that. Take it away.
I'll take it away. So I think it's important to look beyond the first 10 years. We've all focused on this 10-year window, but when you see what goes on over a longer term.
You mean in the 10-year window on the CBO chart?
Well, yeah, in general, all the scoring and all the discussion has been about the next 10 years.
Summarize really quickly the first 10 years, just for our viewers that aren't as familiar. What does the first 10 years show?
The first 10 years basically shows a whole bunch of repeal of Obamacare taxes in order to fund the reduction of benefits for Medicare and for other people buying insurance on the subsidies. And it's essentially budget neutral. It might create a little bit of a budget surplus, but it's basically taking away from the affluent their tax breaks, giving it more to the poor for their health care.
Okay.
So what happens after that is actually quite interesting, because what's really become clear is that the Republican plan favors the old over the poor. And so if you look down here in the red lines, you can see Medicaid and what happens to Medicaid. Medicaid was projected to grow from about 2% of GDP at the present to 2.7%. But the Republican plan would take it down to 1.4%. Meanwhile, Medicare, which is a more expensive program and is currently in the 3% range, would actually grow all the way up here to the 5% range, 6% range over the same period of time. And as you know, Donald Trump has promised to do nothing to Medicare. So therefore, you have a case where Medicare is going to rise sharply. Medicaid is going to be sharp.
He also, I mean, he conflated, maybe because he didn't know the difference at the time. He also said he wasn't going to do anything to Medicaid.
He said he wasn't going to do anything to Medicaid.
He wasn't going to touch Medicaid.
And now look what he's doing to Medicaid. So he has said that, but the Republicans sort of took the ball and said, we're going to go after Medicaid.
Yeah, so those lines, if you look at those lines, Frank Bruni, conservatives who actually have courage have been talking about how Medicaid, Medicare, and Social Security together we're going to bankrupt this country over the past 20 years. Also a lot of Democratic CEOs, a lot of Democratic think tanks agree. And so here you have the Republican plan that takes care of one out of those three, but coincidentally, the one that they attack takes care of the poor.
But they were also working with a president who, during his campaign, and this is one of his many points of tension with the Republican Party, was saying he wasn't going to touch any of that. And I don't even think they know how to go forward with him in many respects, because this is also a president who's been so inconsistent, praised the House bill and then turned around and said it was mean, said that repeal and replace had to be done at the same time, and then tweeted, no, maybe we'll separate them. I don't know how you move forward coherently and effectively when the person at the very top keeps giving you such mixed messages.
Well, Bob Costa, you can't get anybody to talk about the issues that really matter on long-term debt in America, and that is figuring out how to save Medicare and Social Security. They've got the Medicaid part down, but you know, maybe you've got a handful of true believers in the House and maybe one or two in the Senate, but nobody else is talking about the program that's exploding the most, and that's Medicare.
No one's talking about it. It remains a political third rail. House Republicans, including House Speaker Paul Ryan, do want to tackle entitlement reform. But for now, they're just really going after this Medicaid expansion under the Affordable Care Act. But here's the troubling reality for the GOP right now. We're going to hear a lot in the coming days about Senate Majority Leader Mitch McConnell and whether he has the votes in the Senate. But the reality is that this law has taken root in many of these states. Many Republican governors, Republican leaders in the states across the country are counting on the Medicaid expansion. Regardless of anything McConnell can do to twist arms, that reality makes it very difficult to pass this bill.
It'll devastate the budget, Shamish wanted. You get rid of the Medicaid expansion, then that means a lot of governors in Republican states are going to be scrambling and going to have to make some massive cuts.
I mean, and that's why you see Republican senators and Republican governors really pushing back on that. They understand that Medicaid is not just funding people's trips to the doctors, but when you put up that chart talking about old versus poor, the people that are benefiting from Medicaid are also old, poor people. So you think about the nursing homes that are going to be kept open in Ohio or in Michigan. In my trips, I've gone to Mississippi, where people are saying that is a central part of how older, poor people get their health health insurance. So this is a thing that Republicans know is a big problem. And as Frank said, the New York Times has put out a pretty comprehensive look at who is hiding from this. There are Republican senators who are essentially hiding from their constituents because they understand that people understand this so well.
All right.
So let's put some flesh around Yamisha's very good point and look at what's going to happen to Medicaid under the Republican proposal and how much the cuts would be. Now, these are all relative to what otherwise would be spent, and we can have that debate. But again, these are some new analysis that just came out. And if you go out to 2036, excuse me, you can see what happens to each of these different groups. It's important to remember that Medicaid is not just women. Poor women. It covers a whole range of things. 64% of nursing home bills are paid by Medicaid. 50% of all childbirths are paid by Medicaid. 20% of all Americans are on Medicaid. And so what you can see what happened under this bill is the expansion adults, those who are getting their Medicaid from the Affordable Care Act. Now, these are not the poorest Americans. These are people between 100% of the poverty line and 400% of the poverty line. They're going to lose 53% of their benefits. And then as you go up further into other adults, into children, into the aged, the nursing home phenomenon, and disabled, you can see that the numbers are not quite as large, but they're still very large. And these people, as Yamiche alluded to, get reimbursed for a lot of services that Medicare does not cover and that they need in order to have a reasonable standard of living.
Right. So let me ask Bob Costa. We hear from a lot of Republicans that there aren't any Medicaid cuts.
Right.
It's a talking point. I mean, even people that I'm a huge political fan of will go out and say, oh, no, there are no Medicaid cuts. What am I missing?
Well, I'd like to get Steve's answer to this question, because this is what Republicans are talking about. They want to roll back the Medicaid expansion under the Affordable Care Act, and in place of that expansion, put in a guarantee, this is the way the bill may pass, a guarantee that if Medicaid costs rise, the funding will rise along with the cost of medical inflation. What does that do to the Medicaid population, Steve, from your analysis, if they do that?
You still would not be able to meet the needs of all the Medicaid recipients because the number of recipients is also growing. So simply raising it by the amount of money for the existing pool, and even that may not be enough, isn't going to do it. So it's simply another way, and in fact, some of those numbers are in what I just showed you. It's simply another way to cut Medicaid. Now, look, I would be the first to admit that Medicaid is a very, very fast-growing program, and probably one that would benefit from a tougher look at some of the ways it's delivered. There may well be cost savings, but simply taking a battle axe and saying we're going to cut 53%.
Well, actually, you have been part of a group that said, I think responsibly, we've got to look at Medicaid, we've got to look at Medicare, we've got to look at Social Security, and Yamiche, a lot of people, responsible people on both sides of the political divide, understand entitlements need to be taken care of. This is just a disproportionate whack at one of those three, and it happens to be the one for the poor.
Exactly. I've talked to a lot of think tanks and a lot of experts on both sides of the aisle here in D.C., and they say they all agree that something needs to be done. The problem is that President Trump has really kind of boxed himself in promising over and over again that he wasn't going to touch Social Security and Medicare and then Medicaid. Now we have the administration kind of saying, well, you know what, Medicaid, the way that we're touching it is different than what the president was talking about on the campaign trail. And then when they're cutting Social Security disability, which is part of Social Security given by its name, the budget director is saying, well, that's not actually Social Security, that's something different too. So what we're really seeing is they're trying to keep promises to the base that really made Donald Trump popular, and really, frankly, made him popular among people who were even Democrats, because he was running on those issues almost to the left of Hillary Clinton, telling people that Hillary Clinton was going to be the one that was going to take away their health care, telling people that Hillary Clinton was the one that was going to take away the entitlement programs. And now that he's in office, he understands that he has this pressure to keep that promise, but in reality, it's fiscally irresponsible on both sides of the aisle, people agree, to not do anything about those other two programs that only touch Medicaid.
Noah.
Yeah, Steve, that graphic is really perfectly illustrative of how difficult it is to reduce outlays from any one of the three major entitlement programs. And as you say, it's a necessary evil, but it's one that we have to deal with eventually. But we don't want to use the battle axe. It seems like the battle axe is really not that far off. One of these ideas that was circulating over the weekend is maybe we have to just pass a repeal of Obamacare and just let it sit there for a year. And because nobody will ever let that happen, right? It's too insanely stupid. And yet, I'm reminded of the Budget Control Act and sequester, which was designed to be really stupid. No one would ever let that happen. And yet it happened. We just sort of were inching towards the battle axe, whether we like it or not.
Look, that whole idea is stupid, as you implied.
But possible.
But possible. Remember, we are facing another overarching budget problem, which is that the CBO last week raised the estimate for the deficit this year by $135 billion or something like that, raised all the out-year estimates of deficits, and we are basically in a position where, because of entitlements largely, our deficit is just going to grow and grow and grow. So we haven't really wrapped that into this conversation, but dealing with that is a big part of it.
All right, sum it all up in 15 seconds, Frank Bruni.
Kind of hard to do, but all right.
Well, I would say this. Interestingly, the Republicans have lost the messaging war here, and they've lost control of the conversation. There's an important conversation to be had about what the government can and can't afford and how to control costs going forward. And because of the clumsy way in which health care has been pressed forward, the conversation is entirely about cruelty. And Democrats are winning the messaging war on this in a big, big way.
All right. Robert Costa, Yamiche Alcindor, thank you very much.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.